Okay, it's Dr. Buford here. We're just getting started on the left knee. And this is our first real look inside the medial compartment here. And so as we start to look, we can see a couple things right off the bat here. You've got a fair amount of the weight-bearing portion of the femoral condyle has some thinning of the cartilage here. And you can see how these areas are soft. So we're going to go ahead and we're using our shaver here just to make sure there's nothing that's really loose. Okay. And now the hard part, here, hold the camera for a minute. We're going to try and get into the back of your knee so we can see this meniscal tear back here. You can see how some of these loose pieces of cartilage happen here. So, this is the torn meniscus, and it's actually, it's actually got a bit more damage to it than we were hoping. Table down a little bit, please. Just down a little bit. And so we're just looking, trying to see if this is a repairable injury. That's good. And so far we're just working on the edge. You can see some of the loose pieces floating by. And that's what we wanted to see. So there's actually a split in the meniscus back here also. So that makes it not really a meniscal tear that we can put a stitch in. So we'll need a pair of scissors or biters. So, and the other thing is, as you look at the top of the screen, you can see how you've got some areas in the femoral condyle where you've lost a fair amount of cartilage at the top of the screen. So we're going to put in a pair of scissors here and see if there's anything we can do to just take off the inner edge of this meniscus that's torn. Do you have anything that curves up? So we'll keep working here, show you some more in a little bit. Okay, so we've taken off just a little bit of the posterior horn, the part that I think was bothering you. We've left the most of the body and anterior horn. And what's remaining looks pretty stable to me. We've just been kind of fine-tuning it. Trying to focus right now. So that looks pretty good now, okay? And again, the real story is you've got a little more arthritis than we were hoping to find, plus that meniscus was a little more torn. So I think we're done in the medial compartment. We're going to have a look in the central part of the knee where some of the big ligaments are, the ACL and the PCL. And as we look up here, sometimes there's a little bit of soft tissue in the way that we can remove that'll help us see. We'll get a good picture and show you some more in just a minute. Okay, so the anterior cruciate ligament is right in the middle of the screen here. You had a pretty thick, kind of scarred down fat pad But now we can get a really good look at the central part of the knee. So the inside or medial is over here. Here's the ACL coming off of the tibia running up towards the back of the knee, back here. And then we're going to look in the lateral compartment here. And what we can see initially is the meniscus looks pretty good there. And then as we pull back, yeah, we can see pretty much the entire meniscus. And the joint surfaces look good, so that's encouraging. We'll keep looking here, show you some more in a little bit. Table. Okay, so now we're just looking at the patellofemoral joint. That's the patella at the top of the screen, your kneecap. Over here laterally, lateral facet looks pretty good. And then in just a second, we'll track down the front of the knee all the way down to the where the ACL tucks underneath there. This is the trochlea. And then we'll look over medially. You can see over here. So that all looks pretty good. So it's really that medial compartment we'll have to keep an eye on. We're just going to now make sure there's no other loose pieces to worry about, and then we're going to get you back to the recovery room. So good luck to you now, okay? Bye-bye.